It was meant to be a relatively straightforward hospital visit for Keren's spokes's mum, Mabel Thatcher, known to her family as Gloria.
She went in for very, very high blood pressure. She normally has high blood pressure, but this was just a little too high.
After a week of treatment on June 15, the 83-year-old grandmother was moved to Brunswick Private Hospital in Melbourne's north. It was then that Keren and her family became uncomfortable with what they saw as a lack of COVID-safe measures at a physiotherapy session at the start of Melbourne's second wave.
My niece Amy went in to see my mum. Patients were sitting in a circle, chair to chair, no social distancing. Also, a lot of the other staff weren't wearing masks.
Keren also claims that her mum was not tested for coronavirus while in hospital, despite having cold symptoms.
That just makes me very, very angry. There are doctors there, surely they could have picked up a runny nose and a really hoarse throat.
Brunswick Private says there was nothing in Mrs Thatcher's medical record to suggest this, nor were concerns raised by medical practitioners or the family at the time. 2 days after her mum was discharged, Keren heard the news that the hospital had been declared the centre of a COVID cluster that soon grew to at least 22 staff and patients.
I rang my mum and dad straight away, and they said, and I asked if they had been contacted by the hospital, and they said no. I got onto their social media. The CEO of the hospital called me straight away and told me everyone had been trace contacted that had come into the contact with COVID, and he kept saying I had nothing to worry about.
The hospital says updates relating to Brunswick Private are issued by the Department of Health and Human Services. 6 days after being discharged, Gloria became seriously unwell. She tested positive to COVID-19.
I rang my mum to speak to her, and she couldn't breathe. And I just told Dad to call the ambulance straight away. That was it. The last time I've seen my mother or spoke to her.
She was admitted to Royal Melbourne Hospital, where her symptoms worsened.
She deteriorated very, very quickly. And she passed away the next day on the 17th at 7:30 at night. You put people into a hospital to get better, and they should know all the rules.
Lejeanne Lefebvre's mother-in-law, Thelma Billows, was in Brunswick Private Hospital at the same time as Keren's mum. They were both discharged on July 6.
It broke my heart for the fact that her mother actually tested positive.
Unlike Keren's experience, the family says the hospital did call them the night Thelma was discharged to say that she had come into contact with a COVID-positive patient in one of her classes.
And it made me feel sick, to be honest, because I thought, we got the phone call and they didn't.
Lejeanne says the hospital had strict measures in place regarding temperature checks for visitors and use of hand sanitizer. However, like Keren, Lejeanne also has concerns about the lack of some staff wearing masks, particularly given the number of elderly patients she saw at the hospital.
3 that I have distinct memory did not have masks on. That's 100%. And one of them was actually in her room.
Brunswick Private Hospital declined 730's request for an interview, but in a statement said the situation in Victoria rapidly changed and that mandatory wearing of masks came into effect for all patients, visitors and staff upon identification of the first COVID-19 case and prior to the official state directives issued by the Victorian Chief Health Officer. The hospital disputes claims of a lack of social distancing, saying, "We have enhanced our practice to place designated floor markings on the ground as a visual reference for our allied health therapists."
I think the current policy of healthcare staff wearing masks in hospitals, if that had been in place at the beginning of the pandemic and certainly at the beginning of the second wave, I think a lot of healthcare worker infections and other infections in the hospital setting could have been avoided.
Karen and her family hope lessons have been learnt so that no other family has to suffer the same heartbreak.
I wanted to do this interview for one reason and one reason only, and that is to stop this happening to anybody else.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.